Hello, I'm Dr. Phillip Beyer. Today I'm going to talk to you about comparing the 1918 Spanish influenza to the present day COVID-19 pandemic. 101 years ago, the world and the United States were faced with the worst pandemic recorded in modern history. The 1918 Spanish influenza was caused by H1N1 influenza A virus, thought to be of avian bird origin, whereas today the COVID-19 virus is caused by the SARS-CoV-2, thought to be of mammalian or bat origin. Present-day epidemiologists and virologists now believe the Spanish influenza, as it was called, may have actually began in Haskell County in the United States or in France, not Spain. First place of origin most probably is the Wuhan Institute of Virology in Wuhan, China. Populations affected by these two major pandemics differ. In the 1918 pandemic, it killed disproportionately a number of 25 to 40-year-old. The COVID-19 affects mostly people over age 65 with comorbidities or other illnesses. In 1918, the mortality rose to 8 to 10% in the 25 to 40-year-old range group, with an overall mortality of 2.4%. COVID-19, those 18 to 44-year-olds accounts for only 3.9% of the total deaths. Overall, COVID-19 mortality very similar at 2.4%. The 1918 influenza spread to most of the countries in the world and infected about 500 million people, roughly a third of the world's population, and resulted in the deaths of over 50 million people, including 675,000 Americans. COVID-19 has spread to most of the world's countries, with only a few isolated islands being spared. The WHO, World Health Organization, says there have been over 207 million cases recorded, with 4.3 million deaths as of August 16, 2021. Please note there have been delays in reporting from some of the African countries. The cause of death of the Spanish influenza was secondary bacterial pneumonia. The cause of death of COVID-19 is an reactive immune system leading to end organ failure. In 1917, the first vaccines became available for pneumococcal pneumonia and were tested and successful, but were used in only a limited research setting. Antibiotics and vaccines were not available worldwide at the time. Today, we have multiple vaccines available in the world, but much of the population has not yet been vaccinated, either because of vaccine not being available or by choice. The Spanish influenza lasted from 1918 to 1920 and consisted of 4 waves. Scientists at the time could not study if any mutations had occurred. The COVID-19 pandemic originated in December of 2019 and is still active today. Since the world virus is spreading, we have had 4 waves at this point in time, but we don't know how many waves will follow. The main reason the waves or spikes of coronavirus cases occur is because of human behavior. Being cautious by physical distancing hand washing, and mask wearing lessens the likelihood of future waves. Now let's discuss more about COVID-19. How does COVID-19 mutate? Mutate means to change. Change or cause a change in the form or nature. When the virus affects you, it attaches to your cells, gets inside them, and makes copies of the RNA. This helps them to spread, and if there's a mistake, the RNA gets changed and thus mutates. Scientists call these changes mutations. For example, the current Delta variant is a mutation of the coronavirus, which is more effective and spreads more readily. What is herd immunity and how is it achieved? Herd immunity happens when a large population, the herd, is immune to the virus. This can happen either because people get vaccinated or had already been infected. The herd makes it harder for the virus to spread. So even those who haven't been sick or vaccinated have some protection. The problem with getting sick to get immune is that some of those people will get seriously ill and some of those people may die, and the virus will continue to mutate. Thank you for your time.